Good evening, everyone. Hope you guys had a good 4th of July. Tonight, we're going to be talking about, do you really know if you have high blood pressure or not? So I've previously given talks on endothelial function. The endothelium is that inner lining of your blood vessels. One of the things that releases is nitric oxide. Nitric oxide is a short-lived gas that dilates the smooth muscles, your arteries, that keeps your blood pressure down. So if you have endothelial dysfunction, it's likely going to drive high blood pressure. But tonight we're going to talk about how do you actually measure blood pressure, and then what are some of the devices you can look to see, do you have what's known as white coat hypertension or mast hypertension? So first off, blood pressure cuffs. So you definitely want to have one that at least fits over your bicep. The ones that fit on your wrist generally are very inaccurate. The one, and I don't get paid by the company, but Omron tends to make some very good blood pressure cuffs to be used at home. This particular one has Bluetooth. It does the Omron Evolve, and it just keeps a logbook on your phone, and then you can show me in the office or show your doc kind of a trend of your blood pressure at home. But here's how you do a blood pressure reading at home. Generally do it first thing in the morning, but you definitely may want to be taking different times of the day because blood pressure is under circadian rhythm control, so your blood pressure can fluctuate throughout the day. But you want to make sure that you don't have any stimulants in the system right before you do the blood pressure. So you want to avoid any nicotine, caffeine, or alcohol within a few hours of doing a blood pressure if you want to have a true measurement. You want to be in a rested position, so feet on the floor, back supported, arm at heart level on a table, or resting on something that keeps it at heart level, and then measure the blood pressure after you've been sitting down for at least 5 minutes optimally. And then if it's quote high, and what is high? Well, anything really over 120/80 is considered abnormal, or not optimal. Different levels indicating different risk of end organ damage. So end organ damage is damaging your brain, causing a stroke, damaging your heart, causing heart failure or heart attacks, damaging your kidneys, causing kidney failure. Those are kind of end organ damage of elevated blood pressure. But ideally, your blood pressure would be whatever number, and if you don't think it's what it should be, check it in a couple minutes and average it out. But that's kind of how to take a normal blood pressure. If you see me in the office, we have a mercury sphygmomanometer, mouthful, but the mercury tube is the most accurate way to measure blood pressure manually. The most accurate blood pressure measurement is in my old days when I was an invasive cardiologist. I'd feed a catheter through your radial artery or your femoral artery and put a pigtail catheter above your aortic valve and measure the blood pressure as the blood was leaving the heart. And then we push that catheter down in the heart and measure the blood pressure inside the heart. So I don't think anybody's going to voluntarily sign up for that unless they're having some symptoms. Doing a manual blood pressure cuff in the office with a mercury column is the most accurate way to get a measurement. But tonight I want to talk a little bit more about the ambulatory blood pressure monitor, the 24-hour ambulatory blood pressure monitor. So this is a new toy that we got at Apollo Cardiology. I've had this at my previous practices, but this is the first time it's live at Apollo Cardiology. But there's something known as white coat hypertension. So what is that? One reason I'm wearing black. No, I'm just kidding. White coat hypertension is when you go to the doctor's office and your blood pressure is elevated, and then you tell the doctor or whoever's taking your blood pressure, my blood pressure is never this high. It's always, quote, normal at home. And that is possible. But white coat hypertension typically is due to high stress levels, high catecholamine levels. So in our office, we use something called the Max Pulse. It measures pulse wave analysis. So if people's blood pressure is high in our office, we hook them up to the Max Pulse and tells us how stiff their arteries are. If they have stiff arteries, then their blood pressure really is probably actually elevated at home as well. And maybe they still have an accurate cuff and they're not getting the true measurements at home. So another kind of bonus tip tonight is if you see me in the office, or if you're not in the St. Louis area, just take your blood pressure cuff with you to your doctor's visits. Let them check the blood pressure however they normally do it, and then check it with your machine right after that and see how close they are and see how calibrated they are. I've had patients find out that their blood pressure cuffs are 20 to 40 points off, too high or too low. So you want to make sure your blood pressure is calibrated at home so you get true accurate numbers to say your blood pressure is, quote, normal at home. But there is a device called an ambulatory 24-hour blood pressure monitor, and it does just that. You wear it for 24 hours. It's kind of like having a Holter monitor. Instead of measuring your heart rhythms, it's measuring your blood pressure. And it can be set to measure 2-3 times an hour depending on what your doctor wants. But it gives you a 24-hour average blood pressure, but it also, because your blood pressure is under circadian control, you'll see your blood pressure fluctuate throughout the day. Your blood pressure is typically rising from 6 a.m. to 10 a.m. As cortisol rises and your body's getting ready to be awake for the day, and you'd be pumping blood to your brain to get up and move around And then in the evening time, blood pressure should be coming back down. There's something that this monitor can do, which will measure your dipping status. So your blood pressure at nighttime should actually drop. It should drop at least 10 to about 20% from your baseline throughout the daytime. If it drops less than 10%, that's known as non-dipping. And that actually puts you at increased risk of heart attack and stroke because your organs are going to see higher blood pressure as you sleep. Your blood pressure again starts to rise, 4 a.m. or so. If your blood pressure is high to begin with, it starts spiking up higher, then that's when events happen. And if you look at all the data, the majority of heart attacks and strokes typically happen in the morning time. They can happen 24 hours a day, but the majority are early morning. And that's why typically these people probably were non-dippers. There are people who can be excessive dippers where the blood pressure drops more than 20% when they're sleeping. I've not personally seen that, but that does increase your risk as well. More likely to pass out, and actually is not good for you to have a super dipping status where you're dropping more than 20%. But then there's also people that are not just non-dippers, they're reverse dippers where their blood pressure actually starts spiking up as they're sleeping. One reason that potentially could be is they have obstructive sleep apnea. Their airway closes off, that puts a lot of stress on the thoracic cavity, and your blood pressure is going to go up in kind. So if you have a dipping status that pushes your blood pressure up at night, and you don't already know that you have apnea, you probably should get a home sleep study or talk to your doctors about potentially getting set up or something like that. I've worn one of these devices in the past. It is kind of odd that it buzzes throughout the day. Just let your arm hang loose and it takes the measurement. It's not that horrible to wear while you're sleeping. Did wake me up a couple times when I did it, but I was able to go back to sleep. But it does give your doctor significant data. If you say, my blood pressure is quote normal at home, this will prove that you have normal blood pressure at home and that you're only quote high in the office. But there is something that, unless you do something like this or are very diligent at home checking blood pressure multiple times a day, that you could miss. You could miss something known as masked hypertension, MASKED. So that is basically the corollary, the reverse of white coat hypertension. Your blood pressure is normal in the office, but at home it's very high. And so unless you check your pressures at home, you won't know that. Your organs do know that. Your brain, your heart, your liver, your kidneys see high blood pressures, but your doctor doesn't, and so you don't get the appropriate treatment. My office, I'm going to be looking at entheal function and pulse wave analysis and markers of inflammation and vitamin D status. So typically I'm going to find, if you actually potentially have drivers that could drive your blood pressure up at home. But if you really want to know, do you have masked hypertension? Again, you need something like this. Generally, if you talk to your cardiologist's office, some offices will have this, but not all. It is a service generally covered by insurance. If you have white coat hypertension or labile hypertension where you're on multiple medications and they can't get your blood pressure under control, this will actually help you figure out why it's not under control. And then you can also typically time your medications a little bit better, knowing when the blood pressure is spiking. So maybe you're switching medicines from morning time to evening time if your blood pressure isn't dipping appropriately at nighttime. There's another feature that this particular device will do called a central aortic blood pressure. I may hold off on talking about it a little bit tonight, but essentially that is where you're measuring the pressure as the blood leaves the heart. That's what the pressure that your heart actually sees. And your central aortic blood pressure is actually going to be lower than the blood pressure in your arms. So I'm not saying you could get fooled, but some patients, their blood pressure in their arm is really high and they're on lots of medicines. But if the blood pressure leaving their heart isn't high, the heart is actually not seeing the brunt of that high blood pressure, and you don't have to be so overly aggressive with it. So I'll probably break this up into two parts. So tonight we'll just talk about how do you do your blood pressure appropriately. So get a good cuff that fits on your bicep, sit down, feet on the ground, back supported, arm at heart level. No stimulants in your system, so no caffeine, no nicotine, no alcohol in your system. A couple hours before you do the blood pressure, if you want to have a true level blood pressure, take the blood pressure. If it's not what you want it to be, take it again in a couple of minutes and average it out. Again, your blood pressure is going to fluctuate throughout the day because of the circadian rhythms. You're making different hormones and neurotransmitters throughout the day. So your blood pressure tends to be a little bit lower in the evening time and a little bit higher in the morning time. A ambulatory 24-hour blood pressure monitor will give you your average blood pressure throughout the day. We'll show you where you're potentially having spikes. That will help you pick up, do you have white coat hypertension, where your blood pressure is just high in the doctor's office but normal at home? Or do you have masked hypertension, where your blood pressure is normal at the doctor's office but high at home? And it also gives you your dipping status. So again, your blood pressure should drop by at least 10% while you're sleeping. If it drops more than 20%, which is rare, that actually increases your risk of stroke and heart attacks. But what would be more concerning is if your blood pressure actually is increasing while you sleep. If it's doing that, definitely increased risk of stroke and heart attack, especially early in the morning when the blood pressure is naturally increasing as cortisol is getting released, getting you ready to wake up for the day. Potentially if you have high blood pressure while you're sleeping, might be sleep apnea and you need to go get that screened for and treat it if present. So that's what I wanted to share with you guys tonight, and I'll open it up to questions. And again, in the future, I'll do a whole one on just the central aortic blood pressure. It's fascinating because it will actually help you determine which medications, if somebody's going to be on medications, which ones are going to work better for them. All right. So somebody said that they got the Omron monitor. Yeah, it is pretty cool. It's my favorite one to use at home. You can find them online. Generally less than $100 for it. This particular one, the Mobilograph, this is something I just have in my office at Apollo. It actually has a feature where I can actually do something similar to the pulse wave analysis, the max pulse that I do. So it'll tell you how stiff your arteries are. Stiffer arteries tend to be sicker arteries. So as the blood gets squeezed out of your heart, the arteries, especially your aorta, should act like a accordion, and your blood vessels should quickly expand and contract. That's a healthy artery. Stiffer arteries act like a lead pipe, and the blood goes quickly through there and bounces back. That's kind of how they measure that central aortic blood pressure, which we'll talk about in the future talk. But this can actually measure that pulse wave velocity and give an idea, are your arteries actually pretty stiff? And so that if your blood pressure is high in my office and you say it's normal at home, it's not going to say I'm not going to believe you, but your arteries are telling you that they're pretty stiff, and it's probably that you're actually having higher blood pressure than you really know. And so we do a comprehensive blood work panel and try to get to the root cause of why your blood pressure is elevated. But again, often it's endothelial dysfunction, make the body make more nitric oxide, exercise, green leafy vegetables, outside in the sunlight, UVA sunlight on your skin, makes the blood vessels come to the surface, dilate by releasing nitric oxide. All right, so somebody else has the other one run? Yep. So yeah, if you see me in the office, that's the one I'm always pretty much recommending people pick up. All right, and as we're waiting for any questions to come in on blood pressure, it will not be on Instagram, but I will record it. It'll be on my YouTube channel. I'm going to be doing a talk this Friday at noon Central Time. I'll be talking more about optimal sexual function, mainly on the Phoenix Pro device, how it improves endothelial function of the smaller blood vessels. So it'll be, for anybody who's interested, you can go to my website, drtwyman.com. That's where all my videos and links to my practice are. So if you're interested in that, just send us a message to that portal. But otherwise, the video eventually will be up on my YouTube channel. And then I think next week we'll do Ask Me Anything. So I will put a kind of poll up. It'll be anything heart related, anything biohacking related, anything travel related if you want. I'm pretty good at answering travel related questions as well. That's pretty much my hobby these days. And we'll go from there. So question, relationship between insulin and blood pressure. It's a complicated relationship, but the higher the insulin, the higher the blood pressure is going to be. Multiple reasons why, but people who tend to have higher insulins tend to have metabolic syndrome, so they're going to have high triglycerides, high blood pressure. They're typically, not always, but going to be overweight. So it also has something to do with your circadian rhythms. So your pancreas is under circadian control. If you're pumping out lots of insulin at the wrong times, you're going to hold on to more water, and that's going to raise the blood pressure as well. All right. Well, I'll let you guys go. Hope you guys have a great rest of the week. If you need anything in the short term, just shoot me a message through this platform, or you can go to my website, drtwyman.com, and I'll see you guys next Monday, 6 o'clock Central Time, and we'll do Ask Me Anything.